welcome back to the podcast. Welcome back to the final episode of season 2 of the Dr. Karina Smith podcast. Thank you so much for listening to all these episodes and coming along on this ride with me. If you've enjoyed this season, it would be so helpful and so meaningful for you to give the show a rating, tell a friend about the show, share it on your socials. Every time we spread the message, we get more of these episodes to a wider audience, and it helps the podcast out a lot. It's been a great season. We are finishing up the season with an amazing conversation with Kendall Satie. Kendall has been my own personal bodywork connoisseur for the last couple of years, and she really knows her stuff. I was laying on her table one day and contemplating how when I'm working with patients and feeling the pulses, I'm using this tiny amount of space to gather information. And when Kendall is using the whole body with her hands and feeling things out, she is gathering information that way. And it got me thinking about this idea of the whole body is the pulse. And that's our conversation today. Thank you so much for joining me for all these episodes. We will return sometime next year, but until then, enjoy the show and thank you so much. Hi, Kendall.
Hi, Karina. How are you?
I'm really good, thank you. How are you?
Very well, thank you.
I love that these podcasts always start with like little polite questions and then we just get into it.
Deep dive.
Deep dive, yeah, wherever it goes. For those of you listening and watching, Kendall has pretty much been taking care of my body for, I think, 2 years now. Has it been 2 years? It's been a while.
Maybe even a little bit more.
Yeah. Mm-hmm. And it's been such an incredible journey. And sometimes when I'm laying on the table, I just have these insightful thoughts and I sort of lay yin yoga or I lay Chinese medicine concepts into what I feel like is being engaged with my tissues. And then, I always have these ideas and I say to Kendall, oh, we should talk about this and we should talk about that. So we're going to do that today. But I thought first it'd be great to hear your journey because you've been on a huge journey of study and your passion and where you are now. And tell us a little bit about you, Kendall.
Absolutely. So I have been a remedial massage therapist for about 10 years now. That started in Perth, and it's something that I fell into. And as soon as I fell into it, I knew that it was my thing. And that I was doing what I was meant to do. And so I was doing that for a little while, and then I knew that I wanted to give more. I knew that I could do more. I wanted to be able to offer more. I could feel more. And so I floated a few ideas over a period of time of what that might look like, what I wanted to do. And that ended with moving to Melbourne to study osteopathy. Which was 5 years full time, and through the whole pandemic and all of those joys. So a tricky time, but and a pretty amazing time with everything that I learnt, the people that I met, and the journey was pretty cool. And now I'm working as an osteopath and a remedial massage therapist as well. So in the tiny little infancy of my osteo career, but being able to sort of use my many years of touching bodies and that sort of experience to keep on learning.
Yeah, so much learning. I remember you saying at one point just what an advantage it was when you were studying osteopathy to have had that many years under your belt and that you had such a familiarity with not just like textbooking muscles or tissues in the body, like you had such a felt sense of being able to find them and feel them, and that clinical experience can't really be substituted for just reading books.
Absolutely not. No, and it's something that I'm grateful for every day, and I sort of like growing on that from this starting point, rather than just from a textbook and fresh out of uni. Everyone starts somewhere, and I was there a while ago, but sort of having that experience, and those, I don't know, I guess palpation skills already, it's a big advantage, and something I really love.
Well, and those palpation skills were definitely something that sparked lots of ideas in my head about conversation, because I guess for us in Chinese medicine, whilst we are encouraged to palpate channels and we are encouraged to feel tissue, a lot of what we are training to do is feeling pulses, which I'm holding up my wrist to the screen and placing my fingers on the pulse. We're sort of trained to feel into what initially is a very minute space, but then becomes this universe of discovery with our fingertips. And there's such a conversation that happens with the body with touch and what you're able to ascertain. And one of the thoughts I had was that the whole body is the pulse.
Yeah.
And when I could feel you uncovering things or discovering things or releasing things, I was like, that's exactly what Kendall's doing. She's having a conversation with my body where I don't have to be in there intellectualizing what's happened. There's no, I can't tell any lies about what's going on. There's a real honesty about the touch. And I wonder if you might speak to that a little bit.
Absolutely. And that's, you're spot on. Exactly what you felt is what I'm doing. And I do that sort of from as soon as someone is on the table in front of me, just before we have a conversation before you're on the table, and we, as you know, and we have an idea about what we might want to work on or what I might find. But as soon as I sort of methodically start feeling through the tissues, I'm having a conversation with the tissues and with the body to see what sort of areas I might feel are sort of causing the things that we spoke about in that conversation before we get on the table. So I'm feeling for different things like taut sort of bands, or sticky sort of tissue, or something that might feel a little tight but harder than what I might expect in a muscle tissue. Or there might be areas that are colder or areas that are hotter, or and I like to gently move the person on the table, and then from that I'm getting what the joints are doing. So is there as I'm moving through here, like is the sacrum moving the same way the thoracic is, or in a way that I would expect to find, or is there something that it's just not moving? Or if I'm moving up through the upper body, are the legs sort of moving, or is there a disconnect there? And then building on that, getting into the treatment to treat what I just found from that sort of assessment and that conversation.
Oh, I love that. And I wondered how easy it would be for you to put that into words, because I think sometimes when you have a felt sense that communicates with the body, it's really difficult to put terminology to it, because it seems really simplified to describe a feeling that you get with your hands.
Yeah. And I think over time I've gotten better at that, because I try to explain it to the person on the table as well, especially if I think that's going to benefit them, so they know what I'm doing, what I'm feeling. Or sometimes people ask, they ask what I'm, what I'm feeling, or what I've found, or what their body is telling me. So getting used to sort of putting it into words.
Well, it's really curious, because sometimes I can sense that you're gathering a great amount of information, but the touch that you're placing on certain tissues is really, really light.
Yes.
So it's not like you're digging down and feeling in for deep, knotty, for lack of a better word, tissue. Sometimes it's really, really light. And I imagine it might be something like, okay, well, how well is the skin moving away from that first layer of tissue? Or is it really sticky up at this superficial layer? And if it is, I've noticed that you will often go somewhere quite far away from that place to then begin the process of like clearing and
Yes.
releasing.
Yes. Yep,
Mm,
absolutely. And that's, in that initial sort of touch that really is quite light. It's sometimes it's even skin texture. It's skin texture, or it's, as I mentioned before, temperature, or and then it's how the skin's moving over the fascia, and then gradually easing into that touch to gather more information, or I can just get what I need from that place initially, and then move somewhere completely different and
mm,
stick my elbow in. Um,
yeah.
yeah.
Yeah, I love that. And so, could you give us a couple of examples? Maybe I know you already have, hot and cold,
Mm-hmm.
how like skin texture or tight bands through the tissue. But are
Mm-hmm.
there any other examples of kind of like what's a sort of what's a general entry point diagnostic sweep that you might do of the body before you go, okay, let's go to the next layer and start working.
Yeah. So it'll be sort of those things, that skin texture, temperature, and then skin movement over the fascia, see how that's sort of feeling. And then probably the biggest one for me, and the one that I um get a lot of information for, is that gentle rocking that I do. So it's like a sort of rocking. Sometimes I might start at the legs and work my way up the other way, or start through the torso and then work down the other way. And it's a gentle rocking to see how the joints are moving, or how the joints are moving, and interaction with each other. So if I'm,
Mm,
and what I'm doing is I'm doing that. It's even a visual thing more than a feeling. To see if things are moving as I would expect them to move, from sort of creating that movement. Because if there's no movement, just say, down in that right ankle, from moving, through the hips, then there's something either in the hip or potentially down through that limb that is causing a disconnect in the movement. So then
mm,
I'll sort of dig in a little bit deeper. And then, maybe it is a joint that isn't moving. Maybe it's a tight muscle, or something there that we need to get those tissues moving, to create the movement that we would expect, or that we sort of want to get.
mm. Yeah, when I hear you say that, it makes me think from a Chinese medicine lens. It's almost like you're kind of doing a quick, well, it's not always quick, but you're doing an assessment of where the blockages are in the body, or where there's stagnation, which is a word that we would use, because where there's stagnation, qi isn't going to flow. So you're going to have either pain in those places or dull ache in those places. And then
Mm-hmm.
once that's freed up, then energy can actually circulate properly again through the body.
100%. Yeah, very,
Yeah.
very similar.
Yeah. There's
Yeah.
a concept that's talked about a lot in yin yoga, and I don't think it's exclusive to yin, but yin teachers will use it, and they
Mm-hmm.
call it the melt.
The
And
what?
it's
Sorry.
this, the melt,
The melt.
MELT. Yeah.
Ooh.
And it's this idea of, coming into a yin yoga posture, which if you're listening to this and you don't know what yin yoga is, it's kind of coming into a yoga posture that's fairly supported, with the
Mm-hmm.
intention of kind of stimulating or stretching a certain tissue of the body, or region of tissue. And the melt is this moment where you feel a sense of give, like it suddenly goes,
Mm-hmm.
oh, and it lets go.
Mm-hmm.
Sometimes it doesn't, but that moment is often sort of a quantifiable moment where you could say, okay, that's enough time in the shape. Like you could just measure it on that. And
Yes.
I have had other teachers sort of talk about that same giving or that same yielding can happen from the pressure of touch as well.
Mm-hmm.
Yeah.
Yep.
And so is that what's happening in a session for you?
100%. And
Yeah.
one of my favorite things that happens is when the person on the table acknowledges that as well. And they get that, oh, or did you feel it? I'm like, yeah, yeah, I
Feeling
did.
something letting
I'm
go.
glad you did too.
Yeah.
I like that, the melt, because that's exactly, so I will sort of target a certain area to get that sort of change in the tissues that I'm working on, whether it be soft tissue or a joint or something like that, to get that moment,
Mm.
that, that it feels like an exhale, it feels like a giving in, like a melt, and then retest and see what change it has created, and then find the next point that I want to target for that.
Beautiful. Because
Yeah.
you don't know sometimes how much holding or how much blockage there is in, say, the upper traps or the QLs or all these other places where things just go clank until somebody applies some intention-based pressure, and you're like, whoa, what's going on there?
Yes, exactly.
Foul or quads or,
Yeah.
those really gnarly places.
Yes. Yeah. And
Mm.
there'll be, and yeah, good point, because there will um, often be more than one contributing to a particular sort of, whether it be condition or, area that I'm focusing on or working on. And yeah, sometimes sort of getting that combination of them and getting that right for, whether it be sort of above or below, or, sort of, anterior or posterior, or, getting that little combination of getting all those spots to sort of, yeah, get that
Mm.
desired sort of effect.
Yeah. And so what does tissue feel like when it's inflamed?
Yeah. So it can inflammation can present in a few different ways. One, the most common would be heat, or puffiness. You can actually, there's swelling there. So like excess fluid, where you can actually sort of move it around. You can actually see that. It can be red. But sometimes it can feel, especially sort of in more tendinous sort of areas, or like junctions where, like a bigger joint, let's say, for instance, a hip, it can feel more gritty and sticky. Where, just say if there's a hard end feel, just say if I'm sort of flexing someone's hip and, there's that hard end feel and it doesn't want to go, and that's more bone on bone, then that's something different. But if it's quite like spongy and, the movement is, there isn't quite that range or that movement that you would expect or that you'd want, but it's not like a block, like a hard bony end feel. But it's interesting because inflammation can really feel quite different depending on person to person. More acute inflammation, this is probably a good way to explain it. The more acute inflammation will feel that, red, hot, puffy. But if it's something a little bit more chronically inflamed, it'll feel, more gritty, and it'll sort of have more impact on the movement.
I've heard Andy describe it like a boggy sensation, like muddy, maybe not quite sticky, but you can feel that the fluid that's there is pathological fluid, like it's moved out of where it should be, and it's just kind of sitting in these chambers of, it's like stagnant water in the tissue.
Yes. Yeah. That's, really boggy, really, like quite just, I don't know, not
Swamp.
what you want. Yeah, like real swampy, exactly.
Which is totally different to this idea of tissues being hydrated, right? Because I'd love to talk about this with you too, because we've had some great conversations about hydration and diet and lifestyle and different factors that can affect tissue and make it more pliable and more agreeable to the treatment, and just really like, no, I'm not doing what you're suggesting today. And so I guess that sort of more sort of acute, fluidy, boggy feeling, when that gets really long term, I imagine it's almost that it's like dried out, that grittiness. Would you
absolutely. Like I like to describe it as rubbery, like dehydrated tissue, like dried out, but like rubbery, like, it doesn't move in a really nice, like there's no flow there of, of the fluid in the tissue, but it feel like sometimes it'll move, but it just feels like it's not a productive movement. It just feels really rubbery. Yeah, that's sort of that's when I'm feeling really dehydrated tissue, or tissue that I know is not going to change the way that would want it to change. Yeah, it just feels, the tissues feel really rubbery.
And how do you engage in conversation with your patients about hydration and the effect on their bodies, and what kind of things come up in conversation?
Probably an entry point to that, and something that I find a little bit more to just start the conversation, is literally just asking something as simple as, are you drinking much water at the moment? Just as simple as that, because some people just won't even be hydrating at the simplest level. And in terms of advice that I give around that, interestingly though, actually, just to backtrack, sometimes I find that it can be people are drinking too much water and they're not having enough salt in the diet. Like, they're not having, they don't have the that availability for their body to actually take in that water, because they'll say to me, well, I'm drinking heaps of water. And then it's a conversation about, well, how much, and what are you doing? And then it'll be like, wow, like, you're probably drinking so much water that your tissues are dehydrated. And then it's more of a conversation about nutrition and adequate salts and minerals and things like that. But I guess the conversation around hydration would start quite simply in actually hydrating. But since we have been speaking a little bit more over the last little while, I'll often ask about coffee as well, and things that they could be doing or having that might be contributing to dehydrating their body in other ways, not just the amount of as simple as how much water they're drinking.
Do you find, I wonder if you find it too, that often the coffee conversation goes something like, yeah, I only have 2 coffees a day, or I only have 3 coffees a day, but I have 3 liters of water.
Yeah, 100%.
And as if, and I get it. And I'm kind of becoming the coffee killjoy lady because I've been talking about it so much. But to pull all that fluid out and then put water in, it doesn't exactly equate to tissues getting the nutrition. And just like you say, this has been a brain explosion for me, just appreciating that water is a cleaner. Like, water isn't necessarily on its own going to go into cells. It needs to be carried in with salts, and it needs to be carried in with minerality. So if people are on a really low calorie diet, or they've got a real aversion to salt because they think salt is bad, but they're drinking 2 or 3 liters of water a day, the kidneys are just going to be working really hard. They're going to be peeing all of that out, and they might feel way more dry and thirsty for doing that.
Exactly. And that's what I find probably the more education I can sort of give, because if someone comes in and you're like, oh, have you been drinking much water, or what's your hydration like, or something like that. And if it's like, oh no, I don't drink any water, it's like, okay, well, that's how we can address that. But then if it's like, oh no, well I am, or there's been a few instances where it's like, oh, I don't drink water, but I drink a lot of tea. It's like, oh, well, it's much the same as in the coffee conversation. But looking at the whole picture about what is going into their body, to then, why are the tissues feeling like this? And I guess in that area, I will give suggestions and some advice and some lifestyle advice and everything like that. But if it's something a little bit more in depth, then what I'll do is I'll sort of find someone who'll be able to help in that area a little bit more, like refer off. And then once those sort of things are settled, the difference in tissue can be phenomenal. And then the changes that we get with working with soft tissue and joints is can just be like day and night.
Yeah, 100%. I'll share that one of those coffee conversations with patients was with me. I was drinking 2, sometimes 3 coffees a day, and I came in once for a session with Kendall, and sort of a bit of perplexion in the room, like, what's been going on? Everything feels really unhappy today. And I reflected on that, and I was like, oh, actually, yeah, I've really hit the wall. And so strange that when you go down, you try and stimulate more, and then you dig yourself into an even deeper hole. And as I realized that things had progressively felt even more gritty and sticky in my body from upping my coffee from 2 to 3 a day. And then I went through a period where I just dropped back to 1, and I came in and you were feeling things and you were like, I don't know what you've done, but things feel
Very
markedly different, very different. And I was like, oh, wow. So it's not just a cut back on coffee and support your adrenals and get better sleep. It's a whole body effect. And
absolutely.
yeah, that really inspired me to, just keep working towards changing the habits.
Yes. Yeah.
Yeah.
And what I love about that as well is, I don't know, I guess it helps to build that relationship with someone if you can sort of ask them what they've done or what has changed just by touching their body. Because we didn't have that conversation before you were on the table, and it was just, there's something different here, there's something changed, and then instantly you were like, well, I've just, this is what I have changed. And to be able to, know how much of a difference that has made without you even telling me that, it's sort of, it's one of those moments that can, it really helps to create that trust between, the person on the table and the person treating, but also just really gives you that sort of, I don't know, that awareness or that little aha moment, like, oh, wow, what I'm doing is actually making a real difference to benefit the treatment that I'm doing in this room as well. So it's those little things that sort of just those, that picking up on those little things and having that conversation with someone's body can tell you, a lot.
Yeah. Especially when people are living in niggly chronic pain for a really, really long time, and they sort of just come to the conclusion that that's their body and they have to live with it. And that's not necessarily true. And it might just be a change in your nutrition, even though it sounds really simplistic. A change in your nutrition could be enormous for the changes in your tissues.
Huge.
Yeah.
And, even, not entirely related to hydration, but things, like inflammation, if there's having a really high gluten diet and they're prone to more, more inflammation and systemic inflammation, and then sort of cutting down on, on those sort of taking those things in, and the way that can change tissue as well. There's lots of different little changes that you can sort of make sort of quite broadly that have a really big difference to your tissues, the way they respond.
Well, I'd say for myself, gluten and refined sugar, instantly the next day I will notice that feeling of fluid being pulled out of my tissues, and I'm spongier. It's almost overnight.
Yeah.
And to me, I just look at that and go, I'm inflamed.
Yeah.
And then whether I change my movement diet or not, if I take gluten and sugar out of my diet, it's almost like the whole front of my belly just flattens within a week or 2, which just tells me how much extra fluid is being held in places where it doesn't need to be.
Yeah.
And in Chinese medicine, we've got a really good explanation for that, because whenever there's heat in the body, heat accumulating in the body, that's very dangerous. And so what the body will do to try and cool that down is send dampness to that fluid. And so I think that's why with inflammation, you often see a lot of fluid accumulation as well.
Yeah.
Because it's like just trying to cool it down. And one of the best examples that I can think of is, this is sort of something my teacher, Anne Cecil Sturman, explained, is that, when we think about atherosclerosis and there's these, this plaque, this cholesterol that's lining the insides of arteries, that the plaque is actually there as a form of dampness in the body that's come and pooling and collecting there to try and quench the heat that's in the blood and the heat that's in the blood vessels to try and not inflame the heart. Which is not necessarily how Western medicine looks at it. They just see the evidence of that plaque and think that plaque equates to risks of heart disease. But the plaque might actually be there to try and give someone more time and cool the heat down.
Yeah. Interesting.
Which I think is fascinating.
Absolutely. Yeah. Yeah.
I had a story that I wanted to share that relates to what you said before, which was when you're kind of checking in with somebody and you're building trust, and you might refer to somebody and see big changes with a different modality. We had a great case of that. We had a patient together that you had been seeing for a long time. I think you and Andy had been seeing for a long time. And I think you might have said to this person, hey, I'm just not sure how much further we're going to get with changes unless we can get this inflammation down. So let's just give you an opportunity to get a fresh pair of eyes on this and look at it through a different lens, and let's just see what happens. And yeah, there was a lot of heat and a lot of accumulation of fluid in that person. And so we did, I don't know how many weeks we did. We did a few handfuls of sessions of acupuncture and some really cooling, clearing formulas.
Yes.
I think we used Tianwenbu Shindan for the Chinese medicine folk listening. And I remember this person's tongue completely changed. They had a really crimson red tongue, which is a sign of heat for us. And a week or two after that formula, their tongue was back to a really healthy pale pink. And I was like, whoa, this is amazing.
That's cool.
And yeah, and then the next time that they'd come for body work, the feedback that you shared with me was that the tissue felt completely different, and that these new changes were able to be affected in the body. And I was like, what a cool collaboration. I loved that so much. It was great.
Yeah.
Really.
And that's something that I really love to do in, with people that I treat, that if I just don't like treating for the sake of it without sort of seeing those changes. But, having a network of people around you that, be like, well, we're not getting the change. Well, we can't get the change, that we need, because we need to address other areas. So having that sort of network is pretty special, and just leads to the best sort of outcomes, really.
Yeah, and great connections.
Yeah, exactly.
How much do you consider, and maybe it's so outside of the scope that if you get a hint of it, that referral would take place, but how much do you feel that trauma or unresolved trauma in a person affects the tissues of the body?
Massively. And yeah, you're right in terms of, well, first I would see how much change we could get through calming down the nervous system, like really sort of just doing some really calming sort of changes, and seeing if, what sort of change we could get there, and if like sort of working with the tissue would sort of help with that. But otherwise, as you mentioned before, getting like collaborating and getting a referral sort of happening. There's someone I can think of, like off the top of my head, and where that needed to happen, but sometimes the person's just not ready as well, which is you just need to work with that person and do what you can and have those conversations and keep those channels open. But yeah, a massive part of body work and stubborn tissues or tissues that just won't let go, be a massive component. Yeah,
stubborn tissues and tissues that won't let go. I mean, and it's probably case by case, but do you ever, because I bet you've probably got intuition skills that are there when you're working with bodies, because that's just what happens when you're connecting fields. But are there other clues or signs that you might get that come up for you when you're engaging with someone's physicality that make you think, oh, I think there might be some deeper things going on here? And what would those be?
Yeah, absolutely. So it could be something as sort of obvious as like a clenching or sort of a pulling away, having really big emotional outbursts on the table as well, which is something that can happen. And interestingly, there are certain sort of areas that you can work on that will give that sort of release. Jaw is a really big one for that. So really big emotional releases, but even just, working up through suboccipitals, and just sometimes even just a really light touch, and just having a really big release from that. But yeah, otherwise, tissues that just aren't responding the way that you would expect from the amount of treatment that you give is probably the biggest, or sort of like the hardest one to sort of put the pieces together as well, because there could be so many different contributing factors to it. And after you've had, some people aren't, might not even be aware that the stress they're holding or the trauma that they're holding is a factor contributing to their physical, their tissues, and a reason why we might not be getting sort of results, or the change that we would want, or the change that we'd expect.
Yeah, I imagine there would be some pretty hot spots in the body. And as soon as you said jaw, I was like, oh, of course. Of course, I'm thinking about how often I have people that come and say, I've got chronic jaw tension, I'm a teeth grinder, and it doesn't take too much digging, because I can do that in my treatment space. It doesn't take much digging to find that they are holding so much in. Yeah. And my kind of understanding of teeth grinding at night is that's how the body processes like a bank of emotions that haven't been able to be expressed during the day. And so it just gets processed, or some of it spills over into that, but it's all up here. It's all up here. Yeah,
absolutely. Yep. And even sort of like down the arms as well. And, like even it's always those lighter sort of touches, the more, the subtle sort of treatments that I tend to, in people that are sort of, maybe holding a lot, or their body's not responding for reasons of, trauma and things like that, that those really light, subtle sort of touches are sort of the ones that bring about that sort of response.
The little light touches in osteopathy I call like homeopathic.
Yeah.
But they're so powerful.
They truly are. It's phenomenal. And that's actually an area that I want to study further, like in terms of osteo, like the craniosacral sort of, and like BLT, like balance ligamentous tension, and those sort of more subtle sort of forms of treatment techniques is something that I just find absolutely fascinating and so effective.
Yeah. Well, we live in a culture where people really think that more is more. And that's why I love yin so much. You've got to put in heaps of effort to get the reward. You've got to smash yourself at the gym. You've got to work really hard, long hours. And if you're not doing any of that, then there's a whole lot of dialogue that comes up. But these really subtle but fully engaged practices like getting craniosacral therapy, which sort of just to me, in my experience, I've had it once, feels a little bit like homeopathic Morse code being done on the back of my sacrum. I'm like, I don't know. Like, and really random movements, random frequency. I'm like, I'm not sure what this is, but I'm here for it. And feeling remarkable change.
After. Yeah,
Wow.
absolutely. And that's the thing that I love about it. And yeah, while I'm not, um, yeah, I haven't learned that technique yet in depth, but interesting example is I treated someone for the first time a few weeks ago, and I was just really doing quite gentle, subtle work up around their suboccipitals and through their neck, and even slightly a little bit sort of through their jaw and their temples, but really light, like very, very, very subtle. And, after the treatment, it was, we had a chat and went on, and I saw them again a week and a half later, and they were like, I didn't think you were doing anything on my head and neck, but it has never moved like this before. And it just feels completely different. And they were like, what, how? Like you weren't, because exactly like you said before, people expect this more is more. You need to be getting your elbows in and really digging in there and really grinding and, really sort of, no pain, no gain sort of mentality where it's really cool when you can have that connection with someone on the table and create that change, and for them to be the person to be like, wait a minute, like
Mm.
what was that? Because it worked. Yeah, it's very cool.
And such a defining moment too, because I tend to notice diagnostically that the people that say, you can massage harder if you like, Karina, really means I want you to dig in. I want to feel a lot. I like a hard, intense massage because it sort of matches the way I approach the world. And for folks like that, because I've had a lot of folks like that in my yin yoga classes where you see them driving hard, you see them really going for the very edge of a sensation where you can see them squeezing their teeth together and there might be a light shaking going on. And then over time, you can hopefully coax them back and to know that like way back here where it's subtle is still phenomenally therapeutic, and that you don't have to always approach the world with this more is more mentality. You can actually conserve a lot more of your chi and your nervous system and all those things that are chronically jacked for so many people, and have the most extraordinary outcomes. It's
100%.
amazing.
Yeah.
Yeah.
So in osteo, there's a technique called counter strain. I'm sure it's not just with osteo, but it's literally where you put the body into a position of no resistance. Like you find that the point of ease. So you go into all these different sort of positions, or like flex, extend, like what feels easier, where does the body want to go, and so you find this area of no tension, no strain, and you hold, and then everything around it is much like you were saying before, that melt, like that sort of that to let it go, which is just
Yeah. I mean,
perfect.
we do something similar in yin where when you come out of a shape,
Mm-hmm.
you have dedicated time where you are in an effortless position.
Yep.
And I was just saying this today because I did a workshop today. It's like my favorite thing about the rebound is that it's gently reinforcing the importance of stopping or pausing between big events so you can actually feel what's happened to you
Mm-hmm.
and be in it rather than always in the next thing, always in the next thing, and never actually pausing so you can change direction or noticing. That
Mm-hmm.
sounds like what you've just described too.
Yeah. Yeah. Yes.
Yes.
Oh, I love it.
Do you do that technique where I've heard people talk about it? I think it's an osteopathic practice where you're feeling above the body for thermal temperature. Are you aware of that? Where you can sort of note how far up off the body, like it might be 5 centimeters, might be 10 centimeters, where you lose temperature, or you might get like a cold spot. Is that something that you're familiar with?
That's not something that I'm familiar with at all. It sounds fascinating though.
Yeah, well, I did hear it was an acupuncture osteo
Yep.
conversation that I heard, and it was sort of just
Mm.
it was kind of giving acupuncturists some little extra tools, diagnostic tools that they could use, where you could just be waving your hands over the body to check for where you've got like a cold spot or where the temperature goes high, and just noticing what acupuncture points might level up the temperature.
Ah,
But also where you might over treat somebody and then the temperature drops too low and you've actually, you're consuming too much, or you overdid it.
yeah,
Is there
amazing.
anything like that in osteo that you're aware of?
Not that I'm aware of, and there's so many different, like osteo, like a lot of other modalities. There's so many different ways that you can do it, and there's so many different techniques and approaches that there very, very well could be, but it's not something that I've sort of encountered, that I know sort of which sort of area of osteo do that. It might be something, because I know there is like a sort of technique looking at what is it, or yeah, I'm not sure.
Like
Not sure.
biofields or something like that? Maybe.
Yeah, yeah,
Mm.
something like that.
Yeah, I imagine just with that idea of like rabbit holes that you can go down,
Mm-hmm.
even just the craniosacral rabbit hole, you can go down there and just go in that direction, and so much will
Open up.
open up.
Absolutely, 100%. Like the sort of two, not wings, but sort of there's a real structural or direct sort of school of osteo, or there's the indirect, which sort of has is the umbrella for your craniosacrals and your BLT and things like that, your counter strain. So there's these two little camps.
Yeah.
Yeah, so
The
sort of,
indirect is that where all the woo is? Is that where all the kind of quirky, left of field, interesting new research happens?
yeah, yeah, heaps of interesting new research, and it's really cool when you come across someone who enjoys and practices both, and finding, having those parallels and being able to sort of offer, those two very different but really like beneficial, like sort of using them in conjunction could do
Mm.
pretty phenomenal things.
Gosh, yes. Well, I'm sure your toolkit is only going to get bigger and broader, and what a gift it is to be able to engage with someone and have so many different things that you could choose from to
Yeah,
then bring to the space what's being called for, bring what's required.
that's the plan.
Nice.
That's
Yes.
the plan.
Yeah. The learning never stops, you and I will both
Exactly.
be
Never.
learning forever, which is, I
Yes.
love that.
Yes.
So how can people connect with you if they want to come and see you for a session or engage with you on any platforms?
Yep. So I'm not particularly good at socials. It's on the plan to get better at that. But what I can do is I can give you my details for the clinics that I work in.
Yeah.
And yeah, people can, and I can give you my email address so that I'm contactable that way, or yeah, booking in online at either of the clinics that I'm in.
Amazing. Yeah. So Kendall's in Melbourne. So anyone who's in Melbourne or dropping into Melbourne, I'll make sure that those contact details are in the show notes for today. Is there any last words that you might like to share, or little tips for people in terms of taking good care of their body that we might not have talked about already that you want to
Ooh,
give
probably,
us?
because we've covered a little bit, but probably the biggest thing in conjunction with the hydration, the nutrition, the body work, and looking after yourself that way is movement. I'm a huge advocate for movement, and
Mm,
motion is lotion, and keeping things moving and flowing is probably up there with the biggest sort of topic that I discuss with people.
mm.
Just regular movement, and that doesn't have to be like a big heavy weights or anything like that. Just movement every day.
So just find what works for you and make sure you move your body.
That's it. Yeah, that's probably the key. Finding what works for you, finding what feels good.
Great. Amazing. Well,
yeah.
Thank you so much
you.
for this chat that we've been waiting to have for so long. I'm so glad we've finally been able to do it. And I will see you soon. And thank you so much, everybody, for tuning in today. I'll see you later.
Thank you. Bye.